Hello, J International here, and welcome to the second video in my hair raising tale series. In the first video, I talked in detail about my entire hair loss and hair restoration history. In that video, I also discussed a head injury I had which left me with a large scar, which influenced a lot of my thinking and the decisions I made. So if you're interested in that, I link that in this video and you're welcome to check that out. In this video, I primarily want to talk about where I am now. In that first video, I discuss how I got hair transplanted, and unfortunately, due to some bad decisions on my part, some bad decisions by surgeons, and also due to genetics and the continuing progress of my hair loss, I actually lost all of that transplanted hair. In this video, I'm going to talk about what I've learned and what I'm doing now. After this introduction, I actually have a series of videos where I go through monthly and weekly what I was going through, where I got hair transplanted, and discuss that. I'm 45 and I'm living in Bangkok, and I'm currently working with a surgeon in Bangkok to restore my hair. At this point, I actually have had 8,800 grafts from a combination of my head and my body. In this video, you'll notice that I've actually had more body hair than head hair extracted, and I'm thinking that this video may benefit two groups of people. One, your standard person who wants a hair transplant and is looking to use beyond head donor hair to complete their hair loss needs. But secondly, burn victims or people who have scarring for other reasons and they just simply don't have enough available head hair, because sometimes their head may have been burned and they don't have enough head or scalp donor hair, and body hair may be the last resort for them. So I'm hoping that those people, in addition to your standard person who wants a hair transplant, will benefit from this video. And that's one of the reasons that I show in detail what it looks like, what the scarring's like, and what you might expect as far as regrowth. Previously, I had follicular unit transplantation and follicular unit extraction. This time, and going forward, I'm only having follicular unit extraction, which is where they basically take one hair at a time, or one graft at a time, which can contain multiple hairs, and put that from the donor area into the recipient area. So I previously had my hair transplants, and the hair didn't fall out immediately. It lasted for a while, and I was pretty happy, and then it gradually fell out, and I just kind of stopped thinking about it. I'm in a great relationship, and my motivations for hair are not the same as they once were. What made me get back into the hair restoration game after almost a 15-year hiatus from it is I was recently at my sister's wedding, and she took, of course, a number of wedding photos, and in those photos, to my surprise, I looked totally bald. I have some hair from those previous hair transplants, and in the right lighting and the right angle, I was able to convince myself I had a good amount of hair. But the sun was shining that day, and it was just looked totally bald, and I was really frustrated by that. And I just hadn't gotten past that critical mass required where you have enough density on top of your head that even in the bright sun it looks like you have hair. And that's basically what I'm trying to accomplish now. Let's talk a little bit about why hair loss bothered me and the typical person. When you're losing your hair, your forehead gets bigger and bigger because your hair is moving back. It can change the shape of your head. There's all kinds of hairstyles in this world. Right now I'm more like this guy, but after a little bit of work, I'm hoping to be more like him. We'll see. It's just a matter of time. In my recent hair transplants, they have rebuilt my hairline, and that's what they call framing the face. If you don't at least have a hairline, there's no frame of your face. Basically, it just extends all the way to the back. I recently progressed to what you might call a Norwood 6, maybe even Norwood 7. And they have what's called a Norwood scale, and Norwood 1 or 2 is about here, 3, 4, 5, and you can guess it just keeps going back. I really hated, in particular, being bald in the back. That was more important to me than hair in the front. And when I had an appointment and met my surgeon, that was my primary focus. I thought at first I was only going to do that, just fill in the back. But after talking with her and learning about advancements in FUE, and that they actually can take it from the beard and extended areas in the body now that I was actually going to be able to cover my whole head. And I'll be showing you photos and videos of that. Now, I've watched a lot of hair loss and hair transplant videos. It can be really hard to judge the results because if you're just looking straight on like you are right now, it can look like I have a lot of hair if I only have a little bit in the front. So you really need to see what's called a bird's eye view, that top-down look, to get a true assessment of how good or not a hair transplant was. Now, I believe in the typical video, people are genuinely doing their best. However, hair transplant doctors, in some cases, can be deceptive. They'll do things like have the hair at different lengths, in different lighting. Sometimes the hair will be wet, it'll be combed differently, and you just really can't get a sense of if the hair transplant worked or not. So another thing I want to do in these videos is share what I've learned and hopefully educate you some. And not that I'm an expert, but I certainly have a lot of experience. So hopefully educate you some if you make the decision to get a hair transplant yourself. So the best hair transplant doctors will have consistent lighting, consistent photos, consistent length of hair and styling so that you can really judge the results as good as possible. As I was saying, in scientific studies, it can be difficult to tell if the results one person achieved will be the results another person achieved. So it can be very difficult to get an apples to apples comparison when comparing hair results. You've got the density of the other person's hair. Are they taking finasteride, dutasteride, minoxidil? Are they using a derma roller? What other hair transplant work? What are their genetic factors? So you got to think about all these things when you're looking at one result and trying to determine if you too are going to have this result. And that's why really all scientific studies, it's hard to know if one patient group is going to be the same as another. These are the type of things that help you assess if what you're seeing is what you might get. But as a single point of something you can trust is high resolution photos that doctors are posting where they're showing consistent lighting, length, things like that. And if the doctor is doing that, that probably means both that they're honest and that the patients are happy enough that they're willing to share their photos. So that's a good first thing to look for. With that said, let's continue on my own personal hair restoration journey. I am about to embark on a fantastic follicular restoration journey, and this is my hair before. Okay, a full view. Noi, are you excited for me to restore my hair?
Oh yeah, I can't wait to see the,
I'm gonna have
new
a big...
Jason.
That's right. All right. In addition to my head itself, I am growing a beard because some of the hair may come from there. Yes, you are lucky to have this sexy man view, but the real reason I'm showing you this is chest and possibly abdomen hair is another source. Now this area is darker, and I'd rather have dark hair than gray hair, but I'll take what I can get. Here I am after the first step of the transplant. I had 3,000 grafts in the back. As you can see, they took it from the side of my head and my chest.
Ooh.
There's going to be a couple more steps. I can't take any more from my head because I don't know, because I can't. And so I'm going to take it also from the chin area, the back, which I want to get rid of anyway. I don't know, wherever. Oh, maybe the legs also. So far, so good. Okay.
Okay.
All right. This is at the 3-week mark after my hair transplant. I think at this point most of the hair has fallen out, which can be a little disheartening, but it's also a normal part of the process. Takes about 3 to 4 months before you probably see anything, so it's the ugly duckling phase, though I've been in that all my life anyway. I had my second surgery. This time actually they took from the beard hair, just exclusively the beard, and they put in the middle. I'll show you that in a second. So you can see they took here, and after one day already it looks pretty good, and they took 1,500 grafts, and she thinks she can get actually 1,000 more. I was worried about scarring, but it looks pretty good. So now let's look at where the implant area. So the first time was in the very back, the crown, and now just kind of moving forward until we get to the front. So this was the area where they transplanted hair. It was 1,500, just starting from the last area. Just keep moving forward as we go. Today is August 1st, 2020. It's been about 10 days since my second hair transplant. The first one was in the crown area using a combination of head and body hair. The second one, pretty much on the vertex of my head, that was using only beard hair, which is kind of interesting. And as you can see, that's healed very, very well. It's really in like just a few days, it was undetectable. I thought I was gonna have to cover it up. It's really no problem. And I think I can even take more from that area. So all the scabs, quite recently, they just all came off at the same time, have just come off. So let's take a quick look at that. Let's see here. And it, like last time, it started growing, but something about it this time, it just looks healthier, it looks stronger. I'm actually a little worried about the back area. It seemed to fall out quickly, and I know it's normal for it to fall out, but it seemed to fall out kind of quickly. It's still kind of red. Let's see here, and also, as you can see, I've gotten some kind of infection, a couple like sebaceous cysts. It's like a little red ingrown hair, and then kind of skin abnormalities. I'm not exactly sure why that happened, but I'm not real happy about it. It's healing now. I'm having another one. We're going to just keep moving forward, and I'm having that this coming Friday. Today is Saturday. I guess we'll just see how it goes. This is an update on the portion of the video you're watching right now. At the time that was filmed, I developed a significant infection on the back of my head. I started having all these pimples and cysts, and the area looked really red. I was pretty worried for a while, and it was somewhat recent after the transplant. But looking back, one of the big mistakes I made is my doctor gave me Keflex, an antibiotic for skin infections, as a prophylactic ahead of time. I don't like taking a lot of antibiotics just to take them, so I didn't take those antibiotics. That was a big mistake, and I think that is a big part of why I got an infection. Sometimes you can probably get away with not taking antibiotics, but I would follow your doctor's instructions. If they prescribe antibiotics, I would take the antibiotics. I'm happy that it all healed and it worked out, but it was looking not good for a while, and something I'm glad I got through. Hopefully you can see me okay. I had my third surgery yesterday. I've had 3 now. The first one was on my crown. That was using head hair and chest hair. The second was in, I guess, the vertex, the middle of my head, and that was using beard hair. For this third one, I had planned to continue using beard hair. I was going to use the area they hadn't done before, which is here, 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 and actually a little of my sideburns. But I have an appointment at the U.S. Embassy tomorrow, so I decided it was best not to have to explain why my face had a bunch of red dots on it. We decided to do what you might call the Norwood 7 region, and we used leg hair. I can't exactly show you. See, that's what it looks like. You can see it's kind of bottommost, and then there was a couple gaps also, so we tried to fill in the gaps with also leg hair. Leg hair is not going to grow as thick as other parts of the head. You know, I have limited supply, so I got to take what I can get. And sometimes when you use body hair on the head, it has more blood, and it can get longer and thicker, but it's not going to be like a miracle. All the hair in my crown has already fallen out, which is normal. And then this vertex area, that actually started growing and was doing very well, which maybe the beard hair is more robust. But that's starting to fall out too. Let's take a quick look. You can see the beard hair actually, it's healed very beautifully. Maybe a little bit red. I'm very happy with that, and I'm happy that with the FUE technique you can take from the body. So I actually still have 2 more planned. I want to do this last beard hair in this other part of the vertex, and I'm going to kind of start pushing it here because I want regular hair on the hairline. Then there'll be 1 more, perfecting the hairline, and then using, whatever's left, maybe a little bit of head hair and abdomen hair even. Okay, that's it for now. So it's now 2 days post-op, and I've been able to take the bandage off of my leg. Why am I not wearing a shirt? I want to show you my chest. So I had about, actually I don't even know how many. I think it was about 1,000, maybe 1,500 grafts from my chest area. And you can see that's healing pretty well. There's been a couple little bumps here and there, what they call sebaceous cysts. It's kind of like acne. That's healing pretty well also. So here's my leg. It looks a little bit gruesome because they used a kind of larger caliber punch, but I have actually had this done before on another leg, and it healed just fine. So here's before. I had on this leg, I'm trying to get some sun there. And that healed perfectly. The hair is less thick, but it looks fine. But that was over a decade ago. Okay, so here's the new one. And as you can see, those are some pretty big holes. Fortunately, I do have a lot of leg hair. We took only from the right leg. That's a little better. Okay, there we go again. Yeah, those holes look big. It looks worse than it is. But this should heal completely and look exactly like my other leg. It might take a while, but that's the price you pay. So this is fast forwarding 2 months from when the other video was taken, and you can see it's still red. It kind of looks like a rash, slowly healing. Trying to get some detail in there. And then on my calf also, it's actually kind of hard to see, but there we go, it's a bit better light. Here's another update. This is fast forwarding 4 months from when I had the leg extraction. And you can see the thigh is looking good. It just maybe looks a little bit discolored. Then here we have the calf area. And it can be hard to see. My hair has started to grow back some, so that covers it. You really can hardly see it. But there's a little bit of a time lapse for you so you can get a sense of what it looks like. And while we're at it, might as well look at the chest also. Really almost undetectable at this point. I can hardly see here. I did have a little ingrown hair here. That was painful. Actually, the doctor ended up injecting something to get rid of that. And I shaved this area too. But there really is almost no discoloration or problems. Obviously, is less hair because I had a lot extracted. I still do have some that I can use. That's it for now.